You're on.
Hey everybody, this is Corwin from Parent to Parent, and we're talking about Medicaid so far. I'm here with Satara today to help a little bit talking about what are the types of waivers that we have in Georgia. We call them home and community-based waivers. So we're just going to talk about those Georgia HCBS waivers today. So what are they? Who are they for? How can you apply? What are the different services that they do offer folks? And lastly, how to apply. So we have three different types of waivers in Georgia. The first is called the CCSP, or Community Care Services Program. This program provides special services to the elderly so they can remain in their home or community. So normally these individuals would be in danger of being placed in a nursing home or nursing care facility. And this waiver allows them to remain in their home, in their neighborhood with their family. Individuals must meet the same medical, functional, and financial requirements as for placement in a nursing facility under Medicaid. So the Department of Community Health, or DCH, provides program management and coordination. And for this waiver, the CCSP, there is a waiting list. The second one is called the Independent Care Waiver Program, or ICWP. This is for any adults, so not just the elderly, ages 21 to 64, with physical disabilities. Any type of physical disability or traumatic brain injury is also included in this waiver. Individuals must be able to direct their own care for the most part, except for TBI, and they may be at risk of being placed in a nursing home or hospital. The ICWP has a waiting list. To apply, you go through the Georgia Medical Care Foundation, The third one is the new options waiver. You've often heard it called the Now and Comp. And so this is the one we're going to talk about a little bit more in depth. If you've heard people say, do you have a waiver? Generally, they're talking about this new options waiver or comprehensive waiver, Now and Comp. So what is the Now and Comp?
You want me to take?
Go ahead.
Okay, sorry, I didn't know if you wanted me to take over, or yeah, do the slide and then I'll do the next.
You're good. All right. So this is the largest waiver program in Georgia, and it's specifically designed for people with intellectual and or developmental disabilities. So we call this IDD, intellectual disabilities or developmental disabilities. This is a waiver that everyone talks about when they say, do you have a waiver? There is a waiting list as well for this. We'll talk about that. Its purpose is to keep those who qualify in their homes and communities out of an institutional setting. It is available for all ages. The people on the waiting list have been determined eligible. So they've gone through the process of applying and they've been determined eligible for services, but due to a lack of adequate funding at the time, they're not able to receive them immediately. So remember, waivers are not entitlement services. Georgia determines how much money they will spend on the Now and Comp waiver, and that determines how many people will receive services. So it's based on need, it's based on immediacy of need and severity of need, and it is individualized. This can be very frustrating for families who are sometimes desperately needing these services right away. To be eligible for the waiver, individuals must first have a documented intellectual or developmental disability. The documentation is usually a psychological report written before the age of 21. Second, they must be Medicaid eligible, even if they are not currently receiving Medicaid. Typically, adults over 21 would have qualified for SSI. Third, they must require additional supports beyond what Medicaid provides. So these are additional things that are called supplemental beyond what their just base Medicaid pays for. This often means things like respite, assistance with daily living skills, like feeding, bathing, and toileting. It can also include support during vocational or job activities, recreation, and other community activities. And lastly, the individual must be at risk for placement outside of the home and community. This could be due to a variety of reasons, including aging, sick or deceased family members, homelessness, or severe unmanaged behaviors. So take it away, Satara.
All right, thanks, Corbin. So yeah, so Corbin did touch a little bit about what this now comp waiver services. This is a home and community-based waiver, and last week we talked about what is a waiver, and we talked about entitlement and non-entitlement, and I gave a little explanation about why the word waiver is used. So if you want that information, you can definitely find it in our previous episode. So this one we're talking about, one of the requirements is that the individual should require additional services. And as Corbin said, this is not all the services, this is just some of the services. So for instance, community living support, if your child or young adult requires in-home support, they need help with feeding, bathing, meal preparation, then that's something that the now comp waiver covers. If your child or young adult needs help accessing the community, like going to a restaurant, going to the movies, somebody has to take them there. They need supervision and somebody has to be with them. Somebody has to teach them how to be in a public environment. For those kinds of things, it's called community access, and the waiver covers that. And then behavioral support. If the individual requires, if support staff, like if the people who are caring for your child require training on how to manage your child's behaviors, what are some strategies you can use, or if your child requires some behavior intervention, has some behavioral intervention needs and needs to see a behavior therapist, those kinds of things are covered by the waiver. And then specialized medical equipment. So as you might be aware, we did an episode on EPSDT, which is early periodic screening, diagnosis, and treatment, EPSDT. So that's a federal law. And the federal law says that anything that is deemed medically necessary for a child who has Medicaid cannot deny it. But that law goes only up to the age of 21. So after the age of 21, there are lots of things that Medicaid does not cover. And one of the things that falls under specialized medical equipment and supplies, typically most often, are like diapers or feeding tubes or nutrition. Like if your child is receiving nutrition through a feeding tube, those supplies can be really expensive, and those are the things that the waiver covers because regular Medicaid does not cover that after the age of 21. Or dental services, those are some of the things that Medicaid does not cover after the age of 21, and that's why the now in comp waiver provides or covers services beyond what just Medicaid covers. And so it's important to remember there are some changes that will happen after the age of 21. And so these are just a short list. Environmental accessibility adaptation is, say, if you need to renovate your bathroom because you have to make it wheelchair accessible, they might provide some funding for that. And respite services, if you as a caregiver need to get a break and you need somebody to just come over and watch your child, or if you are going on vacation and you need somebody to come in and stay overnight, those are some of the services that the waiver covers. So there's a long list of services that the now comp waiver covers, but I just wanted to point out what are some of them and why they're outside of the Medicaid, the typical Medicaid services that are there. So how do you apply? Actually, underneath this video, there's a link in the post. There's a link. We put a brochure for the ICWP, the CCSP, and the now comp waiver. And then there's also a link on how you can apply. So you can go online and apply online, but I think you still have to upload some documents on there. So we've put the paper application. The link has the paper application. I would, if you're planning to apply, I would suggest that you use the paper application. It's just easier to submit all the documents that way. Georgia Department of Behavioral Health and Developmental Disabilities, DBHDD, again, there goes another acronym. They're the ones who manage these waivers. So the funding comes through them. So that's why you have to apply through that or through that governmental agency. And anybody, you do not have to wait till your child is 18 or 21 to apply. It's available for, anybody who's above the age of 3 and has a developmental disability or an intellectual disability can apply for it. And so the application is there, so you can click on it, the link, and fill out the application. It's a pretty straightforward application, but if you're needing information and you need, you have questions, another thing that you can do is Georgia, they've divided Georgia into 6 regions. And so you can call your regional office depending on where you live in Georgia, and they can send you an application or they can answer questions that you would have as you fill out the application. You can definitely call us. We can, well, we won't actually fill out the application for you, but we can definitely talk to you to explain what those blanks are, what do they mean by those questions. So those things we can walk you through. So if you're considering applying for it, definitely feel free to call us. These are the regional offices that you can reach if you have questions, depending on where you are located. And so that kind of concludes our 3 Things Thursday for this week. And we will not be having next week because of the holidays, and we will start back on in January. What we're going to do in January is actually we're going to have a staff person from DBHDD, that is Department of Behavioral Health and Developmental Disabilities. She's going to come and talk to us about the services that they provide. So you might really want to tune in January to learn more about the DBHDD services that are available. As always, you can call us at our 800 number or email us through our website. We are always available to talk to families. And if you have any questions, I know this is a complicated matter, so Medicaid is never easy, but if this is the only episode you have watched this month, then you might want to go back and watch other episodes, because we did some basics on Medicaid, services that Medicaid has, types of what is a Medicaid waiver, and then today we did types of Medicaid waivers. So just gives you a little snapshot of what is available in Georgia. Corbin, you had anything else to add?
I will say it's pretty neat what we do here. I had a parent call from out of state recently, and she just wanted to talk to some different individuals in Georgia who had a home and community-based waiver, because she and her family were thinking of moving here. And just another thing we can do is just match you with a parent who understands this process, and maybe their child is already receiving services through the home and community-based waivers, and you want to talk to them about it. So.
Absolutely, yes. So we can match you with another parent. It is a complicated process, and we understand it. Corbin and I are parents too of children with disability and special healthcare needs, so we get it. So yeah, we can definitely match you to another parent who can kind of walk you through the process, and then we can give you information. So thanks for sharing that, Corbin.
No problem.
As always, happy holidays to everybody, and I hope all of you get a time to spend with your families and a little bit of a break. And we will see you back in January for 3 Things Thursday. So thank you.